Hello everyone, Dr. Sam Schroetke here of Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday. So today we're going to film 4 videos and today's focus is on knee pain. So this technique may work for you if you have pain, say when squatting, kneeling, or if you're sitting for a long time, you start getting knee, just kind of around the kneecap here or maybe even on the side. So I'm going to show you guys some exercises that may work. We're kind of staying in the McKenzie fold here, so we're looking for a directional preference. Don't worry, no test on that at the end. All right, so to start, what we want to try to do, if you're getting pain with squatting or sitting, we want to get the knee in the opposite direction, which is going to be extension. So this is the first level of the exercise, and it's just extending your knee and then back. So you're just going to extend it, try to lock it out, hold it for maybe 2 seconds, and then back, so that's knee extension. For most people, that's not going to be enough to have a therapeutic effect on your knee, and so I'm going to show you a progression here. So this one is knee extension in supine or a quad set, right? So what you might need to do is have something underneath to support the knee. You can lay down however you want to, and then you're just going to push down into the towel as hard as you can. Hold for about, I would say hold for about 5 seconds, and then relax. Hold about 5 seconds and relax. Don't worry, I'm going to keep it PG, but I'm going to roll this up here a little bit, just so you can kind of see what's going on. Black socks and shorts, don't say anything. All right, so anyhow, here you are, and I'm going to push down, and then can you kind of get a little close up, just so we can see my quadricep firing, please? All right, so here we are, and I push down, so you see the quadricep engage, and then relax, and I'm really pushing down there. That's important, okay? But we want to get full extension, so this bolsters just if you're uncomfortable with there being no support here. But eventually you want to get to the point where you're unsupported and you're doing that quad set, pushing down as hard as you can, and then relax. Push it down, 5 seconds, 1, 2, 3, 4, 5, and then relax, okay? So again, for most of these exercises, you want to get to end range, and to have a therapeutic effect, you want to have more force and getting to end range. So if there's pain initially, you might have to start with something underneath there, but that's going to prevent you from getting to end range. So I want to remove that eventually, and then force that down so you're really getting that knee extension with this quad set, okay? I would typically do 10 to 15 reps, probably every 2 to 3 hours, okay? So maybe 4 or 5 times a day. But real important that you're using good force, okay? Another progression with this one, okay, is overpressure with your own hand, okay? So I'm going to push down and then push with my hands, just to add a little more pressure, okay? What's common with these exercises is that maybe on your first couple of reps, you might have a little bit of pain, but as you do them, it's going to get less and less and less pain to the point where it's not hurting at all anymore. And sometimes you might get a stretch in the back of the knee. That's okay, all right? So that's knee extension in supine, okay? 5-second hold, 10 to 15 reps every 2 to 3 hours. Again, though, this is not for everyone, okay? So if you have knee pain, it doesn't mean this is necessarily going to work for you. This works for some people, but make sure to check with your physical therapist or your physician before performing this exercise to make sure that it is appropriate for you. Dr. Sam Schroetke here, Physical Therapy and Hand Clinic, signing off.